Welcome to the Southern Regional Testing Agency Dental Examination. Before we begin, Southern Regional Testing Agency would like to wish you all good luck on this examination and in your career. This orientation highlights the policies and procedures which a dental candidate must follow when taking the SRTA dental examination. You may refer to the candidate manual for more detailed information. Part 1. Policies and Protocols. You should only have contact with clinic floor coordinators. This is an anonymous examination, and all evaluations are done by the examiners in the evaluation area. You will have no contact with the evaluation examiners, and they will have no way to identify you. SRTA authorized observers are dentists or dental hygienists that may be present at any examination. Observers will wear an identification badge throughout the examination. At least one clinic floor coordinator, CFC, will oversee all examination procedures and act as a liaison between you and the examiners to facilitate a smooth and stress-free examination. The CFC is not an evaluation examiner, but they may address any non-graded area of your work. The CFC will answer any questions you may have as the examination proceeds. Please do not hesitate to ask. You may keep your candidate manual with you during the examination and refer to it as needed. Notes written in your manual are permitted. However, charts, graphs, picture designs of preparations, etc. may not be taken into the clinic. The use of cell phones, cameras, pagers, and any other electronic devices are strictly prohibited. Although this is a Manikin-based examination, the CDC-based guidelines for infection control must be followed during all clinic procedures and when setting up and cleaning your assigned cubicle. Protective eyewear must be worn by you during all clinical procedures. Penalties may be assessed by CFCs if any violations occur. If you experience any equipment failure, contact the CFC immediately. If repairs cannot be made promptly, you will be assigned to a different operatory. No chairside assistants are permitted for the non-patient examination. Upon entering this orientation, you received a white envelope with a peel-off ID label with your candidate's sequential number on it and identification badge clipped to your packet. You may now open your candidate packet and review all materials. Please check to make sure that your sequential number on the peel-off identification label is correct. Do not forget to bring your packet and its contents, as well as your identification badge to the examination to which you were assigned. The packet contains cubicle cards, progress forms, peel-off ID labels, candidate check-off form, and a manila folder for each restorative and periodontal procedure. There are 4 progress forms. Place a peel-off identification label in the provided space at the top of each progress form. When you receive your cubicle assignment, enter that number in the provided spaces at the top right of your progress form. The progress form provides an opportunity to communicate with the examiners in the evaluation area. An area at the bottom of the progress form permits you to comment to the examiners if you feel it's necessary. For example, gingiva red and swollen in area 12 to 14. All forms should be written in ink. Comments should be brief, and they must be reviewed by a clinic floor coordinator before proceeding. The entry of the examiner's number does not necessarily indicate agreement with the comment. Upon your conclusion of the examination, refer to the candidate check-off list in your packet and turn in all the indicated forms as directed by the clinic floor coordinator. Candidates must turn in all the forms for each part of the examination you were assigned to, even if you didn't take or complete that section. If all required examination materials are not turned in, this will result in your score not being available or reported. Your results will be available online in the afternoon of the next business day after the examination. Scores can be viewed by logging into the SRTA website using the password and username that was created during the online registration process. The results of your performance will be reported to SRTA member states. Part 2. Restorative and Periodontal Examination. Exam schedule for PI2 and traditional examination. Candidates should set up and complete all required paperwork before submitting their Manikin. Candidates may begin picking up their typodonts at 7 a.m. At 8 a.m., the examination will begin. Candidates may manage their own time on the restorative section. When planning for the examination, you should be aware that the time allowed for the entire examination includes the time which mannequins will be in the evaluation area. The minimum time during which mannequins will be in the evaluation area for each visit is 20 to 45 minutes and could be longer depending on the time of day, procedure being evaluated, the testing site, or the number of candidates. The following slides will review the restorative section of the examination. The two restorations are graded as separate examinations rather than two parts of the same examination. Restorative procedures will be performed on tooth number 9 and tooth number 14. Interproximal contacts of this tooth are extremely tight, and the use of a wedge may be necessary to place a strip in between. The use of hand instruments is permitted, such as spoon excavators. However, excessive pressure may result in chipping of the cavo surface margin. Please be cautious when utilizing hand instruments. All restorative teeth will be approved and entered into the scoring system prior to the start of the examination. You may not begin the second restorative procedure until the first restorative procedure has been completed. The second tooth preparation must be in line for evaluation at least 1 hour before the end of the day. All clinical treatment must be completed on the day it was started. The check-in desk will be located convenient to the clinics and the evaluation area. Examiner assistants, known as runners, will transport the Manikin to and from the evaluation area. Mannequins will be examined in the order of check-in. All paperwork involved with Manikin treatment is maintained at the check-in desk. Dental administrators and runners will have no voice in candidate evaluation. You should not ask or expect feedback from runners, as they have no knowledge of your performance. Candidates are not permitted in the evaluation area. Along with instruments, the following paperwork must be sent with the Manikin to the check-in desk: progress form and 1 cubicle card. It is recommended that you bring the manila folder provided to you to keep your forms together during the examination. Mannequins will be sent back if they do not have the necessary paperwork at the check-in desk. If, in your judgment, once an acceptable preparation has been achieved and the preparation needs to be modified to allow complete removal of caries or decalcified enamel, then this modification must be approved in advance by the examiners at the express chair. To request such a modification, you must get a CFC to put a red dot on the upper left corner of the progress form. It is especially important to request a modification if you appropriately anticipate a possible pulp exposure. Important note: if you have a pulpal exposure, you must have the tooth properly isolated and must notify the CFC immediately. The management of all exposures will take place at the express chair in the evaluation area. The progress form, modification request form, and all required materials are sent with the Manikin to the dental administrator and to the express chair for review. The examiners will either grant or not grant your request for a modification and will return the Manikin and progress form with a green dot over the red dot and the modification request form stapled to the back of the progress form. A clinic floor coordinator will return the Manikin to you and confirm that you understand the decision of the express chair examiners. Use of an isolation dam is optional throughout the duration of the examination. The Instruction to Candidate form is used by the examiners in the evaluation area to give instructions to the candidate. The candidate must sign the form, assuring an understanding of the instruction. The CFC will also initial the form. The CFC will then monitor the adjustment as directed. Do not proceed with the restoration until the adjustment has been reviewed and accepted by the CFC. Furthermore, do not ask the CFC to comment on instructions from examiners in the evaluation area. Failure to comply with the requirements of the examination may result in a penalty that could include a 12-month suspension. The following slides will now review the periodontal section of the examination. You will retrieve your periodontal typodont from the CFC and screen the Manikin for 12 surfaces of calculus. You must select one molar and at least 2 additional molars and/or premolars. No more than 4 surfaces may be on incisors. At least 3 surfaces must be on interproximal surfaces of molars and/or premolars. If the candidate's first selection is not approved, a second alternative selection may be submitted. No extra time will be given for submitting a second selection. All calculus must be removed from the entire crown of the indicated teeth within your case selection. When treatment is complete, the Manikin is returned to the evaluation area for the final evaluation. Part 3. Restorative and Periodontal Questions. Part 4. Endo and Fixed Pros section. Note: it is recommended that only air spray be used during these examination sections. However, if permission has been granted to use air and water spray, a mechanism must be in place to collect and remove the water. Exam schedule for PI 1. The following slides will now review the fixed prosthodontic section of the examination. The procedures to be performed are: full cast metal, all zirconia crown on tooth number 3 as the other abutment for the same 3-unit bridge, PFM crown on tooth number 5, 1 tooth of a 3-unit bridge abutment, ceramic crown on tooth number 9. Mark the teeth to be prepared prior to beginning any of the fixed prosthodontic procedures. Verify that you have marked the correct teeth. A reduction guide must be fabricated prior to starting the fixed prosthodontics examination. You may do so once you have received the fixed prosthodontic sextants. Reduction guides may be done without the use of gloves prior to typodont mounting. You may also use purchased, manufactured reduction guides. Other impressions may be taken during the exam using appropriate infection control procedures. All impressions, casts, stints must be turned in at the conclusion of the examination. No isolation dam is required for the crown preparations. If the simulated gingival margin is recessed below the CEJ, prepare the margins to within 0.5 millimeters of the CEJ. The lingual margin for the PFM crown should be prepared for a metal margin, 0.5 millimeters. The transition from the facial shoulder to the lingual margin should begin to occur at the interproximal buccal line angles. The tooth for the PFM crown should be prepared for a porcelain occlusal surface with an optimal occlusal reduction of 2 millimeters. For the full cast gold crown preparation, the occlusal reduction is optimally 1.5 millimeters. No equilibration will be permitted on the typodont prior to or subsequent to any crown preparations. To taper is defined as to gradually become more narrow in one direction. Requirements for tapering are shown below. When you have finished, contact the clinic floor coordinator. Place peel-off candidate label on the poly bag and put stints inside. The CFC will take your poly bag to the evaluation area. The following slides will now review the endodontic section of the examination. Radiographs will not be used during this section as the tooth length is measured prior to the start of the procedure. Follow the procedural steps as listed on the endodontics progress form. Make sure you obtain a CFC number in each box. The procedures to be performed are access opening, canal instrumentation and obturation on anterior tooth number 8. The candidate must fill the canal with the appropriate size gutta percha cone. Access opening on posterior tooth number 14. The candidate must achieve direct access to all 3 canals. It is the choice of the candidate to start treatment on either of the endodontic teeth number 8 or number 14. The candidate may proceed to the other tooth without permission from the clinic floor coordinator. The use of an isolation dam is required for the endodontics procedure. A single dam may be used to isolate both teeth simultaneously, or separate dams for each tooth. No isolation dam may be applied prior to 8 a.m. Do not place an isolation dam clamp on tooth number 8 or tooth number 14, as doing so may cause the crown to separate from the rest of the tooth. On the anterior tooth, the use of warm gutta percha or carrier-based thermoplasticized gutta percha is not recommended for use, as this may damage the plastic tooth. If the anterior endodontic tooth fractures during filling, treatment should be completed. If the crown fractures during treatment, contact the clinic floor coordinator immediately. The cemento-enamel junction, CEJ, on the facial surface should be used as the reference point to determine the fill depth in the pulp chamber. No temporary filling material, cotton pellet, or restorative material should be placed in the pulp chamber. Place a peel-off candidate label on the manila-colored string tag and affix the tag to the hinge area of the typodont. Place your typodont, progress form, in the original packing box, along with the bubble wrap. Part 5. Endo and Fixed Pros Questions.